Attachment theory. Attachment theory in psychology originates with the seminal work of John Bowlby, who was interested in understanding the separation anxiety and distress that children experience when separated from their primary caregivers. In the 1930s, John Bowlby worked as a psychiatrist in a child guidance clinic in London, where he treated many emotionally disturbed children. This experience led Bowlby to consider the importance of the child's relationship with their mother in terms of their social, emotional, and cognitive development. Specifically, it shaped his belief about the link between early infant separation with the mother and later maladjustments, and led Bowlby to formulate his attachment theory. Some of the earliest behavioral theories suggested that attachment was simply a learned behavior. In fact, these theories proposed that attachment was merely the result of the feeding relationship between the child and the caregiver. Instead, he found that attachment was characterized by clear behavioral and motivation patterns. When children are frightened, they will seek proximity from their primary caregiver in order to receive both comfort and care. Bowlby believed that the earliest bonds formed by children with their caregivers have a tremendous impact that continues throughout life. He suggested that attachment also serves to keep the infant close to the mother, thus improving the child's chances of survival. Bowlby viewed attachments as a product of evolutionary processes and proposed that children are born with an innate drive to form attachment with caregivers. The infant produces innate social releaser behaviors such as crying and smiling that stimulate innate caregiving responses from adults. The determinant of attachment is not food then, but care and responsiveness. Throughout history, children who maintained proximity to an attachment figure were more likely to receive comfort and protection, and therefore more likely to survive to adulthood. Through the process of natural selection, a motivational system designed to regulate attachment emerged. So, what determines successful attachment? Behaviorists suggest that it was food that led to forming this attachment behavior, but Bowlby and others demonstrate that nurturance and responsiveness were the primary determinants of attachment. Henry Harlow, in famous studies on maternal deprivation and social isolation during the 1950s and 1960s, also explored early bonds. In a series of experiments, Harlow demonstrated how such bonds emerge and the powerful impact they have on behavior and functioning. In one version of his experiment, newborn rhesus monkeys were separated from their birth mothers and reared by surrogate mothers. The infant monkeys were placed in cages with two wire monkey mothers. One of the wire monkeys held a bottle from which the infant monkey could obtain nourishment, while the other wire monkey was covered with a soft terry cloth. While the infant monkeys would go to the wire mother to obtain food, they spent most of their days with the soft cloth mother. When frightened, the baby monkeys would turn to their cloth-covered mother for comfort and security. Harlow's work also demonstrated that early attachments were the result of receiving comfort and care from a caregiver rather than simply the result of being fed. There are four patterns of attachment. Ambivalent, where children are usually anxious, not focused, insecure, and ask a lot of questions. Avoidant, where children usually are withdrawn, quiet, and anxious. Disorganized, where children are usually angry, depressed, not following direction, short-fused, difficult in making friends. And secure, where children usually have content, engage on task. It is believed that there are some factors that can influence how and when attachment develop. For example, the opportunity for attachment or the quality of caregiving received. Research suggests that failure to form secure attachments early in life can have a negative impact on behavior in later childhood and throughout life. It is also believed that mental health and behavioral problems could be attributed to early childhood. What Bowlby observed is that even feeding did not diminish the anxiety experienced by children when they were separated from their primary caregivers. The long-term consequences of maternal deprivation might include delinquency, reduced intelligence, increased aggression, depression, and affectionless psychopathy. Affectionless psychopathy is an inability to show affection or concern for others. Such individuals act on impulse with little regard for the consequences of their actions, for example, showing no guilt for antisocial behaviors. Children diagnosed with oppositional defiant disorder, conduct disorder, or post-traumatic stress disorder frequently display attachment problem, possibly due to early abuse, neglect, or trauma. Clinicians suggest that children adopted after the age of 6 months have a higher risk of attachment problems. While attachment styles displayed in adulthood are not necessarily the same as those seen in infancy, early attachments can have a serious impact on later relationships. Those who are securely attached in childhood tend to have good self-esteem, strong romantic relationships, and the ability to self-disclose to others. Children who are securely attached as infants tend to develop stronger